Good afternoon, everyone. My name is Deep Silwal, student ID 651560. I am a second year nursing student, and today I'll be explaining about Leon's clinical presentation. Leon is a 67-year-old man who is suffering from type 2 diabetes mellitus. Today I'll be discussing about two therapeutical management that has been planned for managing Leon's condition, which are metformin and plant diet management. Type 2 diabetes is a condition where there is a progressive insulin secretion inability and insulin resistance. During insulin resistance, there is an impaired or reduced capacity of tissues to respond to insulin. This condition grows slowly in skeletal muscle, liver, and adipose tissue. To achieve a homeostatic drop in blood glucose level, the pancreas initially responds by secreting more insulin, but over time, this condition causes pressure on pancreatic beta cell, which then eventually die. This causes decrease in insulin production post meals, and hypoglycemia becomes chronic. According to Diabetes Australia by Royal Australian College of General Practitioners, metformin is safest and most effective and anti-hypoglycemic medication suggested for all adults with type 2 diabetes. Metformin works by decreasing glucose production in the liver through down regulation of hepatic glycogenesis and glucogenesis and increasing insulin sensitivity in muscle cells. This enhances peripheral glucose uptake in the skeletal muscles and reduces fasting insulin level in plasma. This process reduces glucose absorption in the intestine. Leon has elevated hemoglobin A1C level, which is 9%. This indicates uncontrolled blood sugar level. Metformin will help to improve Leon's blood sugar control by improving insulin sensitivity and help to lower his blood glucose level. One risk associated with metformin is potential for lactic acidosis. When patients are ill, they can be dehydrated and the kidney function can be worsened. This reduces the metformin clearance in the kidney, which causes increased risk of lactic acidosis. Self-monitoring blood glucose concentrations should also be continued to monitor blood glucose level. The effectiveness of metformin therapy can also be evaluated by monitoring Leon's hemoglobin A1C level regularly. A decrease in hemoglobin A1C level over time would indicate improved glycemic control and effectiveness of metformin in managing Leon's diabetes. Nutrient-dense foods such as fiber-rich fruits and vegetables can decrease absorption of glucose into bloodstream by preventing sudden increase in blood glucose levels. Organs such as pancreas, liver, muscles, and fat cells have increased insulin sensitivity because of healthy eating habits as cellular uptake of glucose for energy production is improved. Foods such as whole grains, lean protein, fruits, and vegetables have a low glycemic index and helps in glycemic control and regulate his blood sugar level effectively. As per Australian dietary guidelines, this dietary planning in adults can prevent overweight and obesity by reducing the risk of type 2 diabetes. Leon's nutrition intakes of balanced diet, rich in nutrients-dense food, and portion control of diet improves glycemic control, and that supports his weight loss by 5 kg. The regular adherence to this dietary plan can lead to better insulin sensitivity and reduce blood glucose levels. Now I'll be discussing about the second therapeutic intervention for Leon, which is dietary planning. The Australian dietary guidelines provide evidence-based recommendation for healthy eating across different life stages and health conditions for type 2 diabetes. The guideline focuses the importance of consuming a varieties of food from all food groups in appropriate proportion to meet nutrition needs and reducing the risks of excessive weight gains. A balanced diet rich in nutrients dense foods such as whole meal improves blood sugar regulation by regulating carbohydrate intake. For balanced diet, it is necessary to reduce intake of processed food, sweets, and unhealthy fats. As carbohydrates are converted into glucose, the pancreas secretes insulin to regulate blood sugar levels. Leon's treatment plan combining Metformin therapy and adherence to dietary plan offers a comprehensive approach to managing his type 2 diabetes. By addressing both medication and lifestyle therapy, which are metformin and dietary planning, Leon can achieve controlled blood glucose level and improve his overall health outcome.